Welcome back to Studio 10, everybody. It's time for On Your Health. This is where we discuss important medical and health topics with the doctors of Florida Medical Clinic. They're the Bay Area's first clinic to merge both primary care physicians and specialists all under one roof.
And if you're experiencing chronic pain, you'll be very interested to know that there are doctors who don't just treat the pain, but seek to understand and diagnose the root cause of the pain. And here to tell us more about the field of interventional pain management is Dr. Neil Weisman from Florida Medical Clinic. Welcome, doctor.
Thank you very much,
Hey,
Holly and Jerome.
Doctor, before we get into it, I have to do the celebrity look-alike game. Are you thinking what I'm thinking?
Probably not.
Okay. Have you ever been mistaken for Jon Favreau?
Yes.
You see there?
Yes, I have.
That's the first one you've ever gotten right, Jerome.
So have you been asked for an autograph, or what do you do?
Yeah, it's sometimes an autograph, and
do you autograph it as Dr. Jon Favreau?
Yes, and they asked me, I didn't realize you were a doctor as well, and it's impressive.
You're like, I can also treat your pain at the same time as being an awesome actor.
That follows with the, you know, what type of doctor are you, and then certainly that would, you know,
gets to lead you into what you actually do for a living.
Exactly. It's a good segue.
So you are in pain management, and there's a big difference between pain management and pain medicine. Explain to everybody what that is.
Well, essentially there's been some confusion. Originally everything was pain management or pain medicine, and it was all, you know, one specialty. But as some of the treatments of pain management evolved, it became more of an interventional field as well. And part of the pain medicine and interventional pain management are similar in the fact that both look to understand the diagnosis, evaluate the patient, and they differ more in the treatment part of it. With pain medicine, there's more of an emphasis on the medical management with the different medications available for that particular complaint. With interventional pain management, the treatment phase involves more minimally invasive procedures to essentially eradicate the underlying complaint or define it better for subsequent referral.
And one of your specialties comes to that very point that you just addressed, is the diagnostic portion, trying to figure out where it's coming from. And it seems like every pain management doctor would want to do that, because obviously if you're feeling pain, it's got to be coming from somewhere, right?
Correct. All doctors treat pain. When a patient presents to a physician, the number one reason they'll go to the physician is because of some pain complaint. And it's usually a pain that has gone on for a period of time where it's time for that patient to figure out what it is. And so they go to the different doctors for that reason. Now, we'll get a lot of referrals as interventional pain physicians because we can do some diagnostic nerve blocks and other types of modalities to better define the underlying cause of that particular complaint.
Wait a minute, so you can shut down specific nerves? What is a nerve block exactly?
I'll give you a couple of examples. An orthopedic surgeon is evaluating a patient with some shoulder pain, and the diagnosis may be unclear. The patient may have an abnormality at the cervical spine level, at the neck level, and there may be an abnormality at the shoulder level. And so what exactly is generating that complaint when you have two areas of abnormality that may be associated with that same complaint? You know, how do you further evaluate that? A neurologist may be involved with assessing the nerve conduction pathway, but as an interventional pain specialist, through the use of imaging, we can take small quantities of medications and directly place them on areas that we think may be generating that complaint.
Wow.
And based on the patient's response, you can get additional information as to whether that pain is coming from that area or not. Now,
So
there may be, oh, go ahead.
No, I was going to say, so what you do is you're looking for the cause of the pain, not just trying to mask the pain itself.
What I tell a lot of patients that present to the office, they come with certain signs and symptoms, and they all want to be treated.
Yeah.
You know, signs and symptoms, I want treatment. I always tell them there's a very crucial step intermediate to that, and that's diagnosis. And I always tell the patient that the better treatment is going to be based on the more accurate diagnosis. And there are plenty of patients that have come to me and said, I've been treated for so many years, and I ask them a simple question. What's your diagnosis that you've been treated for? And many of them have looked at me and said, I don't know.
Right.
And so you're, of course, going to be treated for many years if you don't know your diagnosis. So it's very important to get an accurate diagnosis, and the more accurate the diagnosis, the better any treatment's going to be.
It's not, the diagnosis itself is not knee pain when your knee hurts. It's what causes the knee pain to happen in the first place.
Correct. That's more the presenting symptom of the patient. Now, when the patients originally see an orthopedist or an internist or a rheumatologist, and the diagnosis may be in question, a lot of times I'll get that referral to either provide some type of intervention, medication management, or reassess the patient and determine if there's another etiology for that complaint.
We're almost out of time, but I'll sum this up as quickly as I can. You told us a story before we came on the air of someone that came in. I can't remember where you said their pain was, but as it turned out, what they were being treated for wasn't what it was at all. It was a blood clot that they had. So,
Which is horribly dangerous.
Yeah, so it's really, what you do is important in isolating what is causing this pain.
That's correct. That's correct. And one of the good things about working with Florida Medical Clinic, it's a multi-specialty group. We have a lot of physicians involved in the treatment of the particular patients, and we have an electronic medical record which helps us to assess all of the physicians who are currently caring for that patient, and allows instant communication back and forth. In the old days, you'd have to call up the physician. You may not get a hold of them because they'll be in with the patient. With the system that we have, we're able to send notes to each other, assign a certain priority level to them. The doctor reviews it, and we can coordinate that care and make it more efficient for the patient. In addition to not duplicating tests, because we have all the tests that all the physicians have ordered, and it's a much more efficient way of providing medical care.
Well, if you'd like to learn more about the latest advances in patient care and medical research, visit Florida Medical Clinic online at floridamedicalclinic.com. While you're there, you can locate the office nearest you, learn about their doctors, and even request an appointment with maybe a celebrity doctor like what we had here today. Look at that.
Thank you.
Thank you very much, Dr. Weisman-Favreau.
Coming up next, Fun with Science, and this segment promises to be very heartwarming
or heart-stopping.
We'll be right back.
This segment was sponsored by Florida Medical Clinic.